The idea that a simple blood draw could tell you when Alzheimer's disease will begin has occupied the far edges of medical possibility for decades. Researchers have long understood that the disease develops silently in the brain for years before any symptoms appear. But translating that biological reality into a practical predictive tool has remained elusive. Expensive brain scans, invasive spinal fluid tests, and complex imaging protocols have been the only available methods for detecting the early markers of Alzheimer's, and their cost and inaccessibility have kept them out of routine clinical practice. A new study published in the journal Nature changes that calculus significantly. Scientists at WashU Medicine have developed a blood test capable of predicting when Alzheimer's symptoms will begin, with an accuracy narrow enough to identify the likely onset window within 3 to 4 years. Understanding what makes this discovery meaningful requires examining what the test actually measures, why previous approaches fell short, and whether the gap between promising research and practical clinical use is as large as it often turns out to be. The compositional difference: the test measures a protein called p-tau217, found in blood plasma. For years, researchers focused heavily on beta amyloid, a protein widely believed to be one of the primary drivers of the neurodegeneration that defines Alzheimer's disease. Beta amyloid accumulates in the brain in the form of plaques, and its presence has long been considered a hallmark of the disease. The problem is that measuring beta amyloid requires PET brain scans, which are expensive, not widely available, and impractical for routine screening. Tau, a different protein, accumulates in the body at the same time as beta amyloid as Alzheimer's progresses. The research team discovered that plasma p-tau217 reflects both amyloid and tau levels simultaneously, making it an unusually powerful single marker for tracking where a patient stands in the disease timeline. Lead author Dr. Kellen K. Peterson described the underlying logic with a striking analogy. Amyloid and tau levels, he explained, resemble the rings inside a tree trunk. Just as counting those rings reveals the tree's precise age, measuring how much amyloid and tau have accumulated reveals how far along the Alzheimer's process has advanced and how much time remains before symptoms emerge. The research team built what they call clock models around this principle, frameworks that use biomarker accumulation to provide time-based staging of disease progression, rather than simply confirming whether a disease marker is present or absent. What the data actually shows. The clock models produced results that surprised even the researchers in their precision. By measuring p-tau217 levels in blood, the team could predict symptom onset within a window of 3 to 4 years. But the relationship between detection timing and symptom onset revealed something more nuanced than a simple positive or negative result. When elevated p-tau217 was detected at younger ages, the interval before symptoms appeared was substantially longer. A patient who tested positive at age 60 did not develop Alzheimer's symptoms until approximately age 80, a gap of 2 decades between detectable biological change and clinical manifestation. A patient who tested positive at age 80 developed symptoms roughly 11 years later. The earlier the protein elevation appears, the more runway exists between detection and disease onset. This pattern suggests that the test does not simply confirm that Alzheimer's is coming, but provides a meaningful estimate of when, with the answer varying based on when in life the biological changes begin. Why accessibility changes everything. The clinical implications of switching from PET scans to blood tests extend well beyond convenience. PT imaging requires specialized equipment concentrated in major medical centers, involves significant radiation exposure, and costs thousands of dollars per scan. Lumbar punctures, the alternative method for measuring Alzheimer's biomarkers through spinal fluid, are invasive and uncomfortable enough that many patients decline them even when clinically indicated. These barriers have effectively limited early Alzheimer's detection to research settings and well-resourced healthcare environments. A blood test changes the geographic and economic distribution of who can access early detection. Blood draws are available in virtually every clinical setting in the world, from large academic medical centers to rural community clinics. The cost difference between a blood test and a PET-T scan is substantial enough that early detection could realistically become part of routine health screening for older adults, rather than remaining a specialized procedure reserved for those already showing symptoms or enrolled in research studies. Senior author Dr. Suzanne E. Schindler noted that their work demonstrates the feasibility of using blood tests that are substantially cheaper and more accessible than brain imaging scans or spinal fluid tests for predicting symptom onset. The shift from exotic to routine is what transforms a scientific finding into a public health tool. What earlier detection actually enables, the value of predicting Alzheimer's onset years in advance, depends entirely on what can be done with that information. If available interventions remain limited, early detection produces anxiety without actionable benefit. The current treatment landscape for Alzheimer's remains constrained, but it is not static. Several therapeutic approaches targeting amyloid accumulation have advanced through clinical trials, and the consensus among researchers is that these interventions are most likely to be effective when administered before significant neurodegeneration has occurred. A patient who learns at age 60 that their p-tau217 levels suggest symptom onset in approximately 20 years has a window that does not currently exist in clinical practice. That window allows for lifestyle modifications with evidence behind them, including cardiovascular exercise, cognitive engagement, sleep optimization, and management of metabolic risk factors. It allows for enrollment in prevention trials that require participants who have not yet developed symptoms. It allows for conversations about planning, caregiving, and financial preparation that are far more useful when conducted with adequate lead time. The precision of a 3 to 4 year prediction window also matters for clinical trial design. Identifying patients at specific stages of pre-symptomatic Alzheimer's has been one of the central challenges of prevention research, and a reliable blood-based staging tool could significantly accelerate the pace at which new interventions can be tested. The widespread assumption that earlier is not necessarily better when it comes to Alzheimer's diagnosis reflects the historical reality that earlier diagnosis offered little beyond prolonged anxiety. The emerging picture suggests that this may be changing. Whether the clock models developed at WashU Medicine ultimately prove accurate enough for individual clinical use depends on validation across larger and more diverse populations, a process the researchers acknowledge as the necessary next step. But the direction the evidence points is clear enough that dismissing the potential of blood-based early detection as premature would itself be a form of premature judgment.